They've stepped up airport health checks in Nigeria as international alarm grows over the worst outbreak of the deadly Ebola virus since it was discovered nearly 4 decades ago. With concern that this health crisis is spinning out of control, the World Health Organization is holding an emergency meeting. It could declare a global health emergency, imposing travel bans and border controls on affected countries. But some say more should have been done earlier.
On several occasions we have repeated that the epidemic is far from being controlled, and I think today, unfortunately, we are very far from controlling it.
This most deadly Ebola outbreak has so far affected 4 countries in West Africa: Guinea, Sierra Leone, Liberia and now Nigeria. The death rate from the current outbreak is estimated at 50 to 60%. Almost 900 people have died. The Ebola outbreak has even intruded on a US-Africa summit this week in Washington.
And let me welcome the delegations from Sierra Leone, Liberia and Guinea, with whom we are working so urgently to control the Ebola outbreak and whose citizens are in our thoughts and prayers today.
Both the American aid workers who contracted Ebola in Liberia have now been flown home for treatment. It's reported 3 Spanish missionaries in Liberia have also now tested positive. But the Americans appear to be improving after receiving an experimental drug.
The company is trying to scale up on the production. It's difficult to produce these particular types of antibody cocktails, and it's not at the level of being able to mass produce.
British Airways has said it's suspending its flights to and from Sierra Leone and Liberia for the rest of this month. In Europe and the United States, the authorities and airlines are monitoring this outbreak closely. The risk of transmission here is said to be very low. And Ebola is containable, but the countries currently affected urgently need more outside help to prevent this becoming an even bigger crisis in the region. Nick Childs, BBC News.